In this video, I'm going to walk you through the various functionality related to appointments and managing appointments. First thing I'm going to do is go to book an appointment. So in a previous video, I showed the process of setting up an organization, which we have one set up here. We do see the patients with that as well. And over here, we now have a list of the details for the organization, the patients. This is the one we want. We have an existing patient, but in this case, we're going to add another patient, and we're going to call this one Bob Smith. I'm not going to provide an email in this case. We'll leave it as it is right now. I'll go ahead and I'll create the patient, and immediately we're taken over to the patient within the organization with the ability to create an appointment immediately. So let's go ahead and create an appointment for today. Bear with me. Test clinic, which we set up in a previous video. And in here, I can book 1, 2, or 3 appointments, or 4 appointments. I'm going to book appointments for all of them in here. I'm going to go to my appointments page here, and now I see the various rooms that are available within the clinics to book them. I could book these for today. I could book them for the following days as well. I'm not able to retroactively book an appointment. So we'll assume this one is for 8 a.m. and this is for our audiometric appointment, as you can see here. Okay, we'll confirm that. Now we can see that that has been placed in here so that we cannot book this slot again. So drug and alcohol is another one. Let's keep this user in the same room. Nurse medical, we'll use the only one where the room has that assessment. And we can see here it takes up 2 slots because a nurse medical does take up 2 blocks or 30 minutes. And now we have a mask fit. That's the final one. So we'll go ahead and add the mask fit. Now we have 4 items in here to choose from. This will allow us to add additional information before things get placed into the calendar. So this one here is for our audiometric appointment. We can confirm the time, and we can also go in here and add some additional instructions or some additional information in here. So I could, for this one, for example, say the patient is aware of hearing loss in the right ear, and the employer is aware of this. There might be something with more context for you. But if I go ahead and update that now we've provided an instruction that the clinician would then go in and see. We also have the ability here to add some services. So we'll add some generic services in here, such as the audiometric test. And if we go back, we can see that service here has been added. You also do have the ability to add different quantities, which may be more relevant when you're charging perhaps a call-out fee, if this is for a mobile test, or if it's tracking kilometers to a particular site. All right, so we have our audiometric one set up now. Now we can work our way down the list to drug and alcohol. I'm going to go ahead and add a service in here for drug and alcohol, and we'll add the only existing service that would be in there for that. All right. And here we have the other 2 items that we can add in here. Because we don't have services set up for them at the moment, we're going to leave those empty. And even the clinician has the ability afterwards to be able to view and add that information. Now, if we go over to the clinics and we go into our test clinic, we're immediately greeted with the calendar. On this page here, on this particular calendar view, the columns are divided by room. So we can see we have room 1, room 2, and if there was a 3rd or 4th room for this particular clinic, you would see those as well in their individual columns there. Now, to start with, the first thing I'm probably going to want to do is assign this to a specific clinician to be able to provide this particular service or assessment. Depending on where you're hovering in here, you're able to see things like the service that you're going to be providing. So in this case, we have an audiometric test. If we go over to our drug and alcohol, you can see the specific service that needs to be provided in there. And then here we can also see information such as, was an instruction added? As you can see in those 5 items, the instruction there at the bottom, we see the assessment type, and we can see the name of the patient, and we can also see the room that they're assigned to, And then right in the middle, you'll also notice that there's the clinician. So what we do need to do next is we should be assigning this to a clinician. We have several ways to assign this to a clinician. We can do it quickly from here, or we can also do it from within the appointment once we click on it. By clicking on here, we now open and show a list of clinicians. Now we have no clinicians in here that are currently have the ability to perform an audiometric test. So let's go ahead back to our clinicians page, and let's make sure that we actually have a clinician that can perform that assessment. So we have this in here. Let's go ahead and let's add all of the assessments for this particular clinician. Okay, this is typically done during your setup process, and it's a question that we'll ask you as we set up the assessments, who is qualified to perform them, but it's also good to know, of course, which ones they're qualified to perform. We do also need to assign the clinic to this particular user. Okay, and so that is a test clinic. Now, if we go back to our clinics page and see this, we now see that Tyson is available in here. We do get a warning within here when we assign them. It says this clinician is not scheduled to work for this appointment time. We do leave this fairly loose for you to be able to decide how you want to handle your scheduling. Perhaps you don't use the scheduling feature in this, in which case we will automatically show these clinicians in here. But if we were to use the scheduling functionality, we would go here, and I'll show more about this in a later video. But for now, in order to assign the clinician, because it is available, we can assign Tyson to this. Now, doing this over here again, you can see that we have a toggle in here to be able to notify the clinician. When they are assigned this appointment, they do receive an email if they have opted in to emails for their settings. And the email will contain the information for this. So this would be ideal if you, for example, worked with contractors or perhaps clinicians that worked on different sites. I will go ahead and I'll assign all of these to Tyson. If Tyson was not available because they're taken for another appointment at the same time, their name would not show up in here as well. So now we're going to go ahead and we're going to open up this particular appointment. You're immediately greeted with the basic patient details and the organization details if it's applicable. And we also see up here that we have the option where it says, has the patient arrived? If we mark the patient as having arrived, we will then see a check mark over here. We also have the ability to edit some patient details if that's necessary before continuing with the appointment. And from here on, assuming I'm the clinician looking at this now, I can see any special instructions that have been added, which we added when we created the appointment. I can see any specific services that have been requested in here for us to use. I can add notes as well, and I also from within here have the ability to change the clinician to a different clinician if one is available. And we also have a documents tab as well in here. We do track by means of the logs page all of the activity that happens or is taken on an appointment. So as an example, when this appointment was created, an email would have gone out, but unfortunately we do not have the email recorded. So we do let you know that the organization email is missing. Same with the patient email missing as well. If those were provided, then we would have basically a success log saying they were emailed and notified about this. We see when a clinician has been assigned, and we can also see when a clinician has been reassigned. And we also get this login here about when the patient has arrived. So let's go back to our notes, and we can add notes for reference when we go back to these appointments. So this is really up to you what information is pertinent to you and your clinic. And we could add a note in here. So for example, we could say the patient has opted out of testing the left ear. We could add some more content as well to this. So we could say the employer is aware of this for this patient / worker. We'll go ahead, we'll create that note, and now we have a list of notes starting with the most recent one first. Another thing that you might want to do as you're working with these is you can actually add documents to this particular appointment. So if it's a consent form or something outside of what our system would generate for documents, you can add that information in here as well. And this information, should you choose, would also be visible to the organization. You do also have the ability to make this particular document unavailable to the organization if it's more for internal use by deselecting visible to organization. And we do give you the ability to upload all major file types that you would expect in there. The upload and continue will allow you to upload the document and then immediately be brought back to this page to upload an additional document, which again improves the efficiency of your team. Or if it was a single document we wanted to upload, we would do that here. We're going to go back. In this case, once we upload that document, the document will show in here. And that's what we want to see. Now, when we go to close out a particular appointment, we would use any one of the options down here. I'm going to start with the reschedule option. Perhaps this person says today's not a good day. We can see what other slots are available for them to book from, either within the same day, or we have the option to go to other days as well in here. I'm not going to reschedule this one, but assuming you've rescheduled this information would then go out to the patient and any organization emails that would have requested to receive notifications of this type. We also have the ability to mark them as a no-show. So we can provide additional information for internal use, and we can also send a message to the client and the patient if required upon marking them as a no-show. And then we also have the ability to cancel this particular patient's appointment. We would select a reason for canceling them, such as client requested, patient requested, internal request, or other reason. And optionally, we can provide additional information within this box down here. We do have the ability to apply a cancellation fee. This is automatically set at 50%, but a cancellation fee can also be waived for organization users, or as an example, reduced in price if this is a volume client, for example, and perhaps they get a free number of no-shows or cancellations in the course of a month. That's one example from other clinics that we've worked with. So selecting this will apply the cancellation fee. Deselecting this will just cancel the appointment, and then there will be no cancellation fee applied to this. We also have the ability in here to complete the appointment. Now, completing an appointment is our way of saying the patient has visited, we've done the tests, we've collected the information, the documents that we have required in here, and so simply put, we could add a note in here, which would also show up in our notes section, and a log for that would also be created as well. And we could also provide a message that goes out to the patient or the client when this is completed. I'm going to go ahead and I'm going to complete this particular one in here, and we can see now that this appointment has been changed. This now becomes immutable. An administrator with access can undo this, but we would not give the clinicians themselves the ability to go in and undo this as an option. There are settings that we can toggle to allow that for clinicians as well, but by default, it's not allowed or permitted. And again, if we go back into here for logs, we can see the additional items that were added in here for the logs, such as a note that was added, an internal note once the appointment was completed, and then also to let us know that the appointment is completed. So that in a nutshell is how the appointments work. You can also see in here based upon the color as to what happened with that particular appointment. So by default, this is a white color in here. In here, if we were to change this and say mark it as a no-show, the color would be different in there as well. I'll go ahead and I'll mark this as a no-show, and I'll confirm that. We can see they've been marked as a no-show, and we have a different color for a no-show. And we may, in this case, apply the cancellation. We won't apply a cancellation fee in this case. We'll go ahead and we'll cancel that. We can see that this one has been canceled for the day. And those are the main three actions that would be taken that would then close out this appointment. Rescheduling does not close out the appointment. It just moves it to a different day within the calendar. If you have any questions, feel free to drop us a line or visit OccuHealthSoft.com and book an appointment. for a demo or some support. Thank you.